The discharge plan says follow up in 2 weeks, but the patient's back in the hospital within 48 hours. Does that sound familiar? Let's talk about how poor care transitioning, gaps in data handoff, and the lack of integrated planning are the reason that your patients are not getting what they need and driving up the cost for hospitals, and what you can do to fix it.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
Hi, Sabrina, your host, and we are here at PointClickCare. We're always so excited about going to conferences. It's where the energy is at, where people can come together, especially for you guys, a product with a marketplace, to get to the head of the users and bring them up to speed of all the new innovations, all the things that's in the tip of their finger, maybe they haven't even explored more.
Yeah.
Brian, so tell us a little bit more about PointClickCare and how did you get so excited to be involved with this organization?
Yeah, so PointClickCare has been around a long time, really well known in the senior care marketplace, or market leader for the EHR there. I happen to run a new and innovative group that that's focused on a wide array of solutions related to value-based care and really tying together all the different stakeholders within the continuum of care. So I'm responsible for we call it the acute and payer division, hospitals, health plans, ACOs, and a lot of what we do is connect those facilities back to our core business, back to that senior care marketplace, and really give our users a broad view of patients as they transition throughout their care journey. Super exciting. It's a big bet that PointClickCare made a couple of years back with a couple of acquisitions. So I have the pleasure of working with these teams and working really closely with our customers. And the big bet is certainly paying off. There's been a ton of excitement from our customers that have come in.
Yeah, so for all of us who are in the space of always innovating, right? And it's exciting when you're wearing those innovator hats. What can we improve? What can we do? And you guys are able to retain those innovations, help people to get to that point faster as a platform. As many of these solutions integrating on our platform, having conversations on the side, is they do need a other system that's also established as PCC, so they can quickly get to the better nursing support, better caregiver support. So that's so crucial for you guys to spot that you already to support their mission as well, because there's always new policy changes. There's always something else that we wanted to do with value-based, and then who knows, the reimbursement model might change again, we have to do something else.
Yeah, there's lots of different things, changing out there. Day-to-day, different value-based care programs, and we're really focused on that space.
What are some of the newer movements within the next quarter or next year?
Yeah, so we've had a lot of expansion of a tool that we call PacMan. It's a tool that we built that connects risk-bearing entities, so ACOs and health plans, or a health system that might be in an ACO contract, to our customers that are using our EHR. And it really doesn't matter which program those providers are participating in. There's a lot of excitement this week of the team program. There's lots of other different flavors of different risk-sharing arrangements. But given the massive data set that we have with our huge customer base in the core EHR business, in a large and growing set of connected ACOs and hospitals and ambulatory clinics in the hospital business. We've created this sort of ecosystem that provides visibility as patients transition from the hospital into a skilled nursing facility or in other types of facilities. So arguably we have a larger data set than anyone else out there, given our time in market and network that we built. And there is information is easy to come by, but presenting it in the right way to a caregiver that can drive efficiency in their workflow is really the secret sauce. And we've spent a lot of time in the past couple of years on that. With our PacMan tool, we've had incredible growth. It's very relevant to all of our customers that are here today, whether they are hospitals, health plans, health information exchanges, or skilled nursing facilities, because they're all stakeholders in sharing or consuming that information. And a lot of conversations that we're having with our customers this week will be around how we refine the tool, how we continue to invest heavily into that tool to make them more efficient, more effective, and really align with a lot of the core values of those value-based care programs.
Right. And overall, the mothership is helping everyone else.
Super synergistic.
Hey, let's do something together. What's the true collaboration looks like? You don't have to do everything on your own. We probably already tested things out, and building your own EHR integration system to be able to compete is a challenge, and you don't have to do that when something is existing. And as you mentioned, you're really trying to expand also on the marketplace to say what would be other great solutions basically in the long-term care space that can be added on to the platform.
Yep.
So what are some you guys are looking for in that space?
We just covered a lot in that first part of the conversation, from how PointClickCare is bridging hospitals and post-acute care setting to why interoperability only matters if it actually improves care at the front line. Brian shared how tools like PacMan are helping ACOs, hospitals, and SNFs access timely, meaningful data during transitions of care, and why turning information into actionable workflows is the real unlock. It's the reminder that innovation isn't about more tech. It's about aligning team, tools, and timing. If you're a founder of a minimum viable product and already got user base and want to present in front of active investors and decision makers from healthcare systems and organizations, then we invite you to apply to be a contestant on HealthTech Showdown. Go to healthtechshowdown.com. Send us a short, under 200 words explanation about your solution and why you want to present in front of investors, backing companies in your niche, and decision makers already looking for what you built, because we curate a panel of judges that you have to meet who are already interested in what you got. Not talking to endless of people at conferences or virtual calls, but they are not actually will ever write a check, or you have to get much bigger before they get interested. Each month, we focus on one major domain like women's health, mental health, digital health, remote care, sleep medicine, age tech, diagnostic, and healthcare education. Now, let's get back to the rest of the episode.
There's a lot of work that we're doing specifically in transitions of care in and around discharge. Arguably, those are some of the more complicated places that providers have been managing through for years and years with disparate technology that doesn't really give them the right information at the right time to make the right decision and really inform the patient, which ultimately impacts the care that they receive and the patient satisfaction throughout that process. So we've got a couple of interesting earlier stage applications that we're talking quite a bit about this week, specifically focusing on transitions of care and making sure timely and appropriate follow-up happens after some sort of clinical event. And then with discharge, really simplifying and making sure that the right steps are taken so that the patient then does the right next thing on discharge. So super critical, amongst our customer base, and again, that spans the whole gamut of care from ACO, hospital, clinic, and of course skilled nursing.
As we're doing a lot of integration, there's some thoughts on how do you make sure the data is translated correctly. And when we have an order, just like we're creating a roadmap to, let's say, climb the top of the mountain, if we're just saying, hey, I have an order here, I need to go somewhere, but there's doesn't have a care plan attached to it, then we don't have a roadmap. How do we make sure that everything is attached to the right flow? So when we do have this transition or do have the next people taking over the care, they know exactly what's happening with the patient.
Yeah, so there's a couple of things to unpack there. First, data availability has grown tremendously in the past 5 years. There's data that is available to be shared now that 5 years ago, people would never consider sharing that data. So I think the market has come to a level of acceptance around safely and securing that data. We invest heavily in the different transmission protocols. We do a lot of API work, smart on fire work, and we provide alerts and notifications into a lot of other native EHR systems. That's really one key piece. I think the other piece to unpack is around what data should be used when and how is that best summarized. And I think that is a huge opportunity in the market. I mentioned we're doing a lot of work around discharge planning. You can log into an EHR and print out discharge notifications or notes on a patient. Maybe that was in the emergency department. You might get a stack of like 30 actual pages of paper. The clinician has to look through that, or the patient has to look through that, and then understand and translate into like what really matters. And the reality is a lot of it does, but providers don't always have the time to look through the entirety of that. And that's where we see a huge opportunity for AI to come into place. And we're doing a bunch of early exploratory work around how we can use AI to summarize those notes, and really what the key things to extract from that are. Again, saving time, really focusing on the key things that really impact patient care.
In this next section, Brian and I dug deeper into one of the biggest disconnects in healthcare. What happens or doesn't after a patient is discharged? He walked us through why simply having an order isn't enough if it's not tied to our clear care plan. Without that, we're sending patients out without a roadmap. We also talked about the massive leap in data availability over the past 5 years, and why the real challenge now isn't just data access, but transforming that flood of information into usable insights. Whether it's pushing notifications into native EHRs or exploring AIs to help distill 30 pages of discharge notes into something actually actionable. It's clear the future is about precision, not volume. Now, I wanted to hear from you before we go to the rest of the episode. Tell us in the comment below or post it on LinkedIn. Make sure to tag me, Sabrina. What's the biggest gap in your patient journey roadmap right now? And how are you solving it? Right. It's so crucial that in my subdivision is cardiothoracic surgery. So when we discharge people, they're on so many more new meds, all these consultants coming in, and then we tell them, hey, go see your primary care doctor. And then they have to sort through everything. And if they're not on the same
they don't have time for that.
System, how are you going to read through all that?
Yeah.
And then what people would read is probably most likely just my plan on discharge, right? Okay, so these things happen, this has changed. But not everyone write discharge summary the same way. They might not have the whole process of what happened to the patient, whatnot. So then you get a different level of information, whether it's the information overload, they don't have time, as you're saying, or I don't even know what actually happened to the patient because there's so little information in
Yep.
it. For you guys, as we're thinking about that holistic pathway from the beginning and to the end and aftercare, right? Are you guys also integrated with, I'm assuming so, with other EHR system where hospital are using differently, outpatient using differently? And if not, how do we make that dot connected?
Yeah. So we interface with almost everything that's out there today. And if we don't interface or are interoperable with it, it's probably because somebody hasn't asked to do so yet. So like I said previously, the data is now available. The technology standards and the transmission protocols are much better. The market is asking for it. But again, the key is really to make sure it's the right data at the right time to make the right decision and really drive that efficiency.
Yes. And it's not just to have more data points, it's really about how do you use it and use it in a way that's very highly intentional behind the mission, the drive. And something I always say to any project, right, any creative is that what's that mission and vision statement? Hold it out, making sure when you start going to the new direction, the new excitement, right, the shiny bells that we want to create is still connected back down to the core of the company, of the mission. So it doesn't confuse other people from within or outside as well. It's always new, exciting thing to hear from founders that you guys have. And also it's a very much giving hope for other people to be in this space, to say we can niche down and still have really a lot of power in this space that perhaps other people haven't looked into enough. So I like to always ask a fun question at the end is that if we give you a magic wand and the magic wand will grant you 3 wishes, what would you use the magic wand for?
Oh boy, 3 wishes. I think number one, having line of sight to funding for a lot of our customers that are reliant on government and spending, and there's a lot of interesting things happening right now around funding, and that impacts our customers. That impacts reimbursement. I'd wave that wand and make that predictable, and give our customers line of sight to what they're going to get paid for the services that they provide. Let's see. 2. I would, if I could wave a magic wand and sort of make things move faster, it would be around adoption of value-based care programs. There's obvious impact to the patient, to the market, costs and clinical outcomes there. And then 3, I would say lean into, I would ask the market to lean into adoption of AI. It's massively disruptive. We had a demo upstairs earlier of an early concept on a project that our product team is working on, and it has the opportunity to fully change the way that clinicians interact with software, making their lives far more efficient. We need everyone to lean into those things, and we will get to the promised land.
Yes. And the fun way is to be open-minded, be okay to change and adapt both the AI and then the other integration system. And also it's as a leader in the space, you want to take care of the people that are using your platform to make sure people have the proper funding to scale. Because at the end of the day, I think there's a lot of amazing ideas out there. They just need some of the help to get them up. Right. And then it's that we're crawling and some of us are walking. So how can we start running now?
Look, we've been around for a long time. We're going to continue to be in the space. We're going to continue to grow and be a leader in helping our customers map out this journey. So, I think we've got a strong reputation of being there for the market, for the different changes, and we'll continue to be there tomorrow. So
exactly,
big opportunity. Looking forward to it.
Perfect. And as we wrap up, what would you want the audience to do? And what is that one call to action you feel like people can really benefit, whether it's from PCC or just general practice?
Yeah. So certainly look to us to be a partner for value-based care solutions. Like I said, we do a lot here at PCC. It's not what we might not be the first thing that comes to mind when people mention PointClickCare, but the unique value that we're bringing to providers that are participating in the space has had incredible outcomes. And I think that there's a long and really interesting runway ahead of us for us to grow together with them and navigate these waters together.
Perfect. For everybody who's hearing, watching, we would love to hear your idea of what are some solutions that you're creating in the space of value-based care. And how would you like to expand and connect with the PCC for the next step of optimization and creativity and doing more for all of us who are positively changing the landscape of healthcare?
Yeah. Great.
In today's episode, I talked to Brian from PointClickCare about the challenges of helping patients move smoothly between different types of care. He shared how their tools connects hospitals, clinics, and senior care facility so everyone can work better together. We also talked about how smart tech like AI can make life easier for doctors and nurses and why it's still hard to get more places to use value-based care. Here are the major learning points in today's episode. Number 1, interoperability isn't optional, it's foundational. Brian emphasized that today's care transitions require real-time, accurate, and summarized data, not just access. Making data usable across settings is now the true differentiator. Number 2, discharge planning is broken. AI can fix it. The conversation reviewed how AI is being piloted to help distill lengthy discharge summary into digestible care plan, saving time for both providers and patients. Number 3, tech-enabled transitions of care still need human touch. Tools like PCC and PacMan might create visibility across the continuum. Not intentional follow-up and accountability post-discharge remains a massive gap. Number 4, the future demands faster adoption of value-based care. Brian's magic wand wishes reflect what many founders feel. Regulatory uncertainty and slow industry adoption keep innovation stuck in pilot purgatory. Number 5, don't just build tech, build alignment with end users. Whether it's hospital system, SNF, or ACOs, tech must fit into clinical workflows seamlessly, or it won't get used. The vision? Collaborative ecosystem, not silos apps. Number 6, innovation thrives where curiosity meets integration. This episode reminds us the boldest idea often come from reimagining how disconnected pieces of the system talk to each other, not just inventing new ones. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.